Well, February is American Heart Month, and unfortunately, most of us know someone who has had heart disease or stroke, even a family member. It is the leading cause of death in the U.S., and 2,200 people die every day because of it. So let's have a positive spin and lower your risk. Dr. Anjanette Ferris, a cardiologist with the Calhoun Cardiology Center, the UConn Health Center, is here to help out with that. Good morning to you.
Good morning,
Thanks
Shirley.
for coming in.
Thank you for having me.
So first of all, let's start with the classic symptoms of a heart attack. We really can't say this too often.
Right. The classic symptom oftentimes is pain in the middle of the chest, pressure-like pain. Sometimes people describe it as feeling an elephant on their chest or feeling that their chest is squeezed.
So you know something's going on, basically.
So you may feel it, but oftentimes it may not present that way. Oftentimes you may have chest pain, it may radiate to the jaw, it may radiate to the left arm. So those are the classic symptoms, but really the number one is chest pain. But we have other symptoms that we can talk about that are not so typical. Well,
for women,
absolutely.
Some of them are silent symptoms, right? And they can be different than the symptoms that men might feel. So what might a woman experience?
So we may not feel chest pain, and we may just experience some shortness of breath, and so that may be one symptom of a heart attack or having problems with the arteries of the heart. There may be fatigue, just overall fatigue. I used to be able to walk up 2 flights of stairs, and now it's difficult for me just to get up 1 flight.
And I thought this was interesting too, pain in your arms, back, neck, or jaw.
Or jaw. And so the discomfort in the jaw may not have any discomfort in the chest, but may have just discomfort in the jaw, in the arm, the left arm, and also discomfort in the abdomen, just kind of discomfort in the stomach. And may say, well, I have a stomach discomfort. I never had this before. This feels a little bit different. We should not ignore the symptoms that we're experiencing. They may indicate something more serious going on, such as a heart attack.
And you mentioned fatigue, but also sweating. Would this be an obvious sweat? You're not working out, and suddenly you're breaking into a sweat.
Exactly. So many of us will go through menopause, and we may say, well, it's just due to menopause. But no, if you break out in you're perspiring, you haven't been working out, you haven't been doing anything strenuous, and you notice that you're perspiring for no reason, yes, it can be secondary to hormones, but you want to make sure that there's nothing else going on. And again, heart disease is the #1 killer in our country, so you want to make sure to be evaluated if you're having symptoms that are new for you.
And no harm in calling your doctor. They can, say, yep, go to the ER right away, or, I think you're good, it might be something else. Always so good to check in, isn't it?
It's better to know and to be safe than to sit home and try to wonder and see if you're making the right decision. Always call if you have any doubt in your mind.
Heart disease is a killer, the #1. It's something that really crosses all lines, isn't it?
Absolutely.
So we want to help you. We want to try and prevent this from happening because prevention is the best medicine, isn't it? So what can we do? What are some things, first of all, I guess, what are some things we shouldn't do?
So one of the things that I always promote is knowing your numbers. So we all should see our doctor at least once a year. I like to say go around your birthday, because you can always ensure that you're taking care of your health and making sure you see your physician. So you know your numbers, know what your blood pressure is. If your blood pressures are running a little bit too high, that's another major risk factor for having a heart attack. Knowing your cholesterol numbers, you want to know your total cholesterol number, your bad cholesterol level, your good cholesterol level. There's another level called your triglyceride level. So all these numbers you want to try to know and write it down when you're in your physician's office.
And we shouldn't smoke, right?
Smoking is no good for us from a heart standpoint and also for our lungs. So individuals who smoke are 2 times more likely to develop heart disease. Not a good thing. And so
for smokers that say, but I've been doing it for so many years, it's too late for me. It's really not, right? You can get some benefits.
The good news from a cardiovascular standpoint, from the heart standpoint, is when you stop smoking, you significantly reduce your risk. So it's never too late to stop. You can oftentimes, after stopping for several years, 5 years often, you can see a lot of those risks go away if you're a heavy tobacco user. So absolutely, the #1, try to stop smoking.
Eat well, exercise.
Absolutely.
Don't be sedentary.
Exactly. And diabetes is also another major risk factor. The importance is, if you have diabetes or high blood pressure, is to make sure that it's controlled and making sure to see your healthcare provider. But the good news is that it is preventable, and so exercising can cut our heart disease risk by 50%. So really just exercising and not just walking each day for 30 minutes at a moderate intensity is what we try to recommend.
Great, Dr. Ferris. Thanks so much. Potentially life-saving information. We really appreciate you reminding all of us of it.
Thank you.